Hello, my name is Dr. Raven, and I will be the one performing your cranial nerve exam today. Is that okay? Perfect. So the first thing that I want to do is just get some basic information from you. I'm sure you already talked with the secretary, but I just want to confirm some basics. Is that good? Cool. So what is your full name? How do you spell that? Okay. And what is your birthday? And your insurance provider? Cool. And are you on any medications right now? Okay. And what is the dosage of that? Perfect. Any allergies that I should be aware of? Okay. Everything in this test is, completely benign. People have reported that it's actually kind of relaxing for them sometimes, so just, relax. But we have some essential oils, and I just want to make sure you're not allergic to anything along those lines. But I think we should be all set. So, I first want to ask you a quick question. Do you know why you're here today? Okay. And do you know what the date is? Awesome. So my patient is alert and oriented. That is good. Now, the next thing I want to do is just put on some latex gloves. Not allergic to latex? Okay. And of course, I did wash my hands before entering the room, but I wanted to make sure that, of course, I'm not getting any germ transfer. So the first thing I want to do is just kind of feel your scalp a little bit. And I'm just checking for any bumps, any lesions, abnormalities. It feels good. Can you tip your head down for me? Okay, your hair distribution looks great. I don't see any bumps. Perfect, you look good and healthy. So next thing I want to do, if that's okay, I'm just going to kind of touch your face and just feel for, any bumps. Just checking for symmetry as well while I'm doing this. Around your eyes and down your nose, your jawline. Everything seems to be in order. So I am quickly just going to listen to your heart and your breathing. So first I'm just going to listen to your heart. You can just relax. Okay, sounds good. And now I want you to take a deep breath in and out. Another deep breath in and out. And deep breath in and out. Perfect. Everything seems to be in order there. So, the first thing that I would like to test with you is your eyesight. So the first thing that we're going to do with this is your pupil's reaction to light. So I have this pen light right here, and it is kind of bright, but it will not hurt you, of course. And I just want you to look straight at my nose, and I'm going to shine it in and out of your pupils, of course. And with any good pupillary exam, I'm going to be looking at the pupil that I'm shining the light in, as well as the other one, just to see how they dilate and retract. So if you just look straight at my nose for me. Okay, good. Good. Perfect. Okay, and the other side. Excellent. Nicely done. Okay, so now I'm just going to do some follow the light. So what I just want you to do is follow the light with your eyes. That is it. So we're going to start here. Okay. You're doing very well. And Nicely done. Nicely done. Now the last thing that I'd like to do with this light is I'm going to bring it in close to you. I want you to follow it. And then back out. Perfect. Okay, awesome. So the next thing that I would like you to do is just to watch my finger, and I just want you to follow it with your eyes. Good. It's very similar to the light, of course, but I like to be pretty thorough with my exams, so you're doing just fine. Okay, and now I'm going to test your visual field. So I'm just going to bring my fingers apart, and you're going to tell me when you can no longer see them. Okay, so just look straight at my nose for this. Good. Perfect. Excellent. Okay. Okay. You are doing so well. So the last thing that I would like to do to test your vision is I want you to look again at my nose, and I am going to wiggle a finger on one of the sides, and you're just going to tell me which side I'm wiggling my finger on. Okay, so again, looking at my nose. Good. Okay. Awesome. Both. Good. And now I just keep looking at my nose. I'm going to move them up a little bit. Okay. Okay, good. And then down. Perfect. You are doing so fantastically. So I am now going to move on to your sense of smell. I have various scents that I would like you to inhale with your eyes closed, and I'm going to see if you can name what they are. So if you'll just close your eyes for me. Just take a deep inhale. Can you place that scent? Good. Peppermint. Nice job. Alrighty. Go with this next one. Take a deep inhale for me. Lavender. Awesome. You are just breezing through this exam. Alright, and a third one. It's not lemon, you're close though. Orange, yeah. Nice. It smells so good, that one. And then we have a final one here. Shake it up a little bit. And this one is a little bit more difficult, but if you take a deep inhale. Yeah, take your time. Inhale again, I guess. Impressive chocolate. A lot of people don't actually manage to get that one. It's kind of hard to identify in a liquid scent form. But that's all right. I want you to put a finger over one of your nostrils and breathe in. And on the other side. Awesome. So your sense of smell is very good, and both of your nasal passages are clear and functional. So that is phenomenal. So the next sense that I'm going to move on to is your hearing. So I am just going to make a sound in one of your ears, if you'll close your eyes, and just tell me which side the sound is being made on. So close your eyes. Good. Okay. Good. Both. Perfect. So, I am now going to whisper some words in your ear, And again, with your eyes closed, I want you to tell me what I am whispering, okay? Red marker. Lipstick cap. Good. And one more. Toasted coconut. Would you like to hear that in the other ear as well? Toasted coconut. Perfect, perfect. Now I'm just going to make a everyday sound in your ears, and I want you to identify what the object is that I'm making this sound with. So close your eyes. On the other side. Good. It's a pen. Sharpie to be exact. So next I want to test your sense of taste. So the first thing that I'd like to do, if you can, just open up wide for me and go, ah. I'm going to look in the back of your throat. Really bring that tongue down. Looks good. No strep throat, which is definitely something I'm looking out for in patients this time of year. And now I'm just going to have you taste some various different things. So if you will just open your mouth wide, and I'm going to put something in here. Again, you're not allergic to it. We already made sure. Just put this in your mouth. Take a good taste. Good. Sugar. Okay. And now again. Open wide. Salt. Okay. And one more. This one is going to be a liquid. Open wide. Yes. Lemon juice. Very good. Sorry if that one's a little bit unpleasant. Some people don't care for sour, but it's important to test. So finally, I want to test the sensation in your face. Now we're going to do this multiple different ways. So I am just going to touch a place on your face on both sides, and you're going to tell me if it feels the same or different on both sides. So starting with your forehead. Same or different? Okay. And your temples. Okay, good. Your cheekbones. Perfect. Then I'm going to do each side of your nose. Good. Your jaw. Perfect. So next I want you to close your eyes, and I'm just going to touch you on your face, and I want you to tell me which side it is on and where I am touching you. Okay, so just close your eyes for this. Good. Good. Perfect. Good. All right. Nice. Finally, for a sensation in your face, I have a Q-tip and a toothpick here. I just want you to close your eyes, and I'm going to lightly touch your face with one of these objects, and I want you to tell me if it is sharp or dull. This should not hurt, but I'm sure hopefully you will be able to tell the difference between the two. So close your eyes. Dull. Good. Sharp. Sharp. Dull. Sharp. Both. Dull. And sharp. Awesome. to conclude, all of your cranial nerves seem to be in order. If you'd like to schedule your next cranial nerve exam, you can, or you can just schedule it if you have any concerns. But I do recommend that people get these fairly regularly, at least once a year, because you never know what could be happening that you might not notice, and you don't want it to develop to become worse. But you are all set, my dear. Thank you so much for being such a lovely patient, and I hope to see you again next year. So stay healthy, drink water, and I hope you have a lovely day.